Hey everybody, this is Mike, and today we're going to start another series of how different theoretical orientations would deal with different problems in the mental health field. So today we're going to talk about Freudian psychoanalysis and how Freudian psychoanalysis would work with ADHD. So we're going to take a look at that, and just FYI, since I'm not an expert in all these areas, I wish I were, I've listed the aid of Gemini AI, so just a heads up, and here we go. So, how would a Freudian psychoanalyst treat ADHD? Well, it's important to preface this by stating that ADHD is a neurodevelopmental disorder with a strong biological basis, and modern evidence-based treatments primarily involve medication and behavioral therapies. Traditional Freudian psychoanalysis, which emerged long before the understanding of ADHD as a distinct condition, would approach it from a very different, speculative, and less directly effective perspective. However, if we were to speculate on how a strictly Freudian psychoanalyst might conceptualize an attempt to treat ADHD, it would likely involve the following. 1. Focus on the weak ego. In Freudian terms, the ego is the part of the personality responsible for mediating between the id, the primitive desires, the superego, moral conscience, and reality. A Freudian analyst might see ADHD symptoms like impulsivity, inattention, and hyperactivity as manifestations of a weak ego that is unable to effectively control impulses from the id or manage external demands. The goal would be to strengthen the ego. Another thing would be to uncover unconscious conflicts. The core of Freudian psychoanalysis is the idea that psychological problems stem from unresolved unconscious conflicts, often originating in early childhood experiences. An analyst might hypothesize that the symptoms of ADHD are a defense mechanism or a symbolic expression of underlying repressed emotional conflicts, traumas, or anxieties. For example, impulsivity could be linked to an unconscious need for immediate gratification or rebellion against perceived external control. Inattention or distractibility might be seen as a way to avoid confronting painful thoughts or feelings, or difficulty in sustaining focus due to internal turmoil. And hyperactivity could be interpreted as an outward manifestation of an inner restlessness, anxiety, or an inability to settle due to unresolved internal tension. We'll also explore early childhood experiences. Freud placed immense importance on early psychosexual development, and an analyst might delve into the patient's early experiences, focusing on 1. The parent-child relationship, how early attachment patterns or unmet needs might have impacted ego development and impulse control. 2. Traumatic events, any early experiences of neglect, abuse, or inconsistency that could have led to emotional dysregulation or a fragmented sense of self. And 3. Fixations, speculating if the symptoms relate to unresolved issues from oral, anal, or phallic stages of development. And the therapeutic techniques, free association. The patient would be encouraged to say whatever comes to mind without censorship. The analyst would look for patterns, symbols, and connections to unconscious material that might shed light on the ADHD symptoms. Dream analysis. Dreams are considered the royal road to the unconscious. The analyst would interpret dream content to uncover hidden meanings and conflicts related to the patient's difficulty. Analysis of transference. The analyst would pay close attention to how the patient relates to them, and this is believed to reflect past relationships and unconscious dynamics. For an ADHD patient, transference might manifest as difficulty adhering to session times, interrupting, or expressing frustration with the analyst's perceived lack of immediate solutions. And interpretation. The analyst would offer interpretations of unconscious material, linking current symptoms to past experiences and unconscious conflicts, aiming to bring these into conscious awareness. The idea is that once these unconscious dynamics are understood, the ego can gain more control over symptoms and they might alleviate. Limitations and speculative nature. It's crucial to understand that this Freudian approach would be highly speculative and likely not a necessarily effective treatment for ADHD. Modern understanding recognizes ADHD as a neurobiological disorder affecting executive functionings, and its symptoms are not typically seen as solely symbolic expressions of unconscious conflict. While a psychoanalytic perspective might offer insights into the emotional experience of having ADHD, for example, how the symptoms lead to feelings of shame, inadequacy, or impact relationships, it wouldn't directly address the core neurobiological deficits. A Freudian approach would also be a long-term intensive process which might be challenging for individuals with significant attention and organizational difficulties. In contemporary practice, psychodynamic approaches, which evolved from psychoanalysis, may be used in conjunction with other treatments for ADHD, particularly to help individuals cope with the emotional and relational challenges associated with the condition rather than as a standalone cure for the core symptoms. So I hope this was helpful. This is how the strictly psychoanalytic Freudian approach might work with ADHD, and we will see how other different approaches will work with ADHD, and then we'll go on to other issues such as OCD, anxiety, depression, etc. I hope you found this helpful, and I look forward to seeing you next time.